Right, so the first part of the deep gluteal testing is palpation. So there's four areas that we palpate. So the first area is the sciatic notch. So you go down to the PSIS, drop down to the PIIS, and then draw a line down to the ischial tuberosity, and it's in the middle. You're pressing down, and that is the sciatic notch. We can also go to the ischial tuberosity, which is here. If it's painful, pressing straight onto it, we're looking more hamstring. If it's just medial, we're looking at possible pudendal nerve. And if it's just lateral, then the ischiofemoral space. You can palpate piriformis from going from a line from greater trochanter to the sacrum, and then in the middle, and they're the key points for palpation. One of the other tests for deep gluteal syndrome will be the piriformis resistance test. So you're going to put her like a little bit like the clam position, holding on to the hip, and then you're going to try and push down towards the bed. So don't let me push you down. And a positive is a reproduction of her buttock pain. Another useful test for testing muscle length of the piriformis is you can flex the hip, we can adduct, and then we can externally rotate. And you'll start to feel a stretch around your buttock, and then back down. And the reason for that, obviously, is at 90 degrees of hip flexion, piriformis becomes a internal rotator of the hip, so you're going to be laterally rotated. Whereas in normal position, it will be an external rotator of the hip. So in this position, we can do some other tests. So first of all, just put your weight onto this side, and you're going to put your hand onto her ischial tuberosity, come back down. And then in this position, we are going to extend her knee and internally rotate and adduct. And a positive is the reproduction of her buttock pain on palpation and on these positions. If we're wondering, is it hamstring, we can also test in this position and put their knee in sort of 30 degrees flexion and push down into my hand. And then put it into 90 degrees, pull into my hand. If we're not sure if it's nerve or hamstring, so we can put it into 30. If that brings her pain on, then we can sensitize by adding dorsiflexion or bring your chin down to your chest, or we can do both. That can be a nice way to see if there's a problem with the sciatic nerve gliding. So that's those two tests. So we're doing the straight leg raise. Now, obviously, if I wasn't blocking the camera, I wouldn't be leaning across, okay? But just to show you, so straight leg raise. If that brings on a buttock pain, we are then doing sensitization.